I welcome everyone to the Healthcare Committee. It is Wednesday, January 31st. And it's Mental Health Advocacy Day in the State House. And I think Monday was a big Mental Health Advocacy Day event. So we have Lori Emerson from NAMI here today who will introduce herself, and then some community members to talk to us. So turn it over to you.
Well, thank you so much, Madam Chair Houghton and House Healthcare Committee members. My name is Lori Emerson. I'm the Executive Director at the National Alliance on Mental Illness of Vermont. And thank you so much for inviting our group to be here today to share information with you on behalf of the 9th Annual Mental Health Advocacy Day. So we've been planning Mental Health Advocacy Day with co-sponsors, and we've had 52 co-sponsoring organizations inviting all their networks to be part of our webinar that we had on Monday, as well as, we welcomed the House Healthcare Committee on a panel discussion. So thanks so very much. And we also appreciate the support of Representative Gina to be able to work with all of you to have a healthcare resolution that will be read, I believe, this afternoon. So thank you so much for that. Just recognizing Mental Health Advocacy Day. And our theme for Mental Health Advocacy Day was focusing on welcoming and caring communities and belonging for all. And that theme really shined throughout the whole day, where everybody was talking about how important it was to create belonging in their own community, to feel that they are welcomed, and with the diversity of people, we just want everybody to feel like they have meaning and purpose and belong. And during our webinar on Monday, we had over 347 people registered and 294 unique attendees. So very pleased this year with everybody wanting to learn more about mental health. And at NAMI Vermont, our mission focuses on 3 pillars. It's support, education, and advocacy. And we increased our impact in fiscal year 2023, where we served 4,410 individuals. And our advocacy platform focuses on preventive approaches, and all to help individuals, families, and community members maintain their mental wellness. And NAMI Vermont is a grassroots nonprofit organization. Our core competency is our lived experience. So people find us when they're in crisis and they need help. And then they come back to us when they're ready to give back to other people. So we are a volunteer organization, and our volunteers administer all of our programs that we have. And the pandemic for us had really shined a light on mental health, and it created loneliness and isolation. But now we're turning that corner. So we can create these social connections and these meaningful relationships with people and being back in person. So it's really critical to our well-being that we are connecting with other folks, because everyone needs to find that meaning and purpose, right? And NAMI Vermont provides these opportunities by training our dedicated volunteers to be able to administer all of our free signature programs. And our signature programs come from NAMI National. And many are evidence-based practices with our family-to-family class, as well as our NAMI Ending the Silence program. And through training our new volunteers, we've started a new in-person NAMI Connection support group in Barre and Rutland, as well as new virtual support group for individuals with mental health conditions. And our Burlington Connection support group has been going strong ever since 2009. We've had the same facilitator at that support group for 15 years. He absolutely loves it. And every single week he's there, and all to help support people. And we're really pleased that we were able to establish a support group in Barre where there's that great need with the impact of the flood. So those programs are all going really strong, and we're very pleased to be back in person with those. And we're getting requests to have our support groups back at the psychiatric inpatient facilities. We were on all the inpatient facilities with our support groups previously, and right now we're back at the Vermont Psychiatric Care Hospital. Rutland Regional is asking us back. And it really is an opportunity to help people, to help the patients there immediately start that healing process with their wellness and talking with other peers who understand and who've been there. And additionally, we have family support groups that are led by family members. And this peer-to-peer model really helps people to feel like they're not alone. And there's no judgment, only acceptance with others who really understand. You know, I found NAMI Vermont many, many years ago, maybe 20 or more years. And I attended the support groups, and I really found like I was able to connect with other people because they had similar experiences that I did. And then I went on to take the family to family class, which is an 8-week program. We're offering it virtually so anybody in the state can participate. And this really helps family members with gaining better coping skills, how to communicate with their loved one, developing a crisis plan. So all of these programs really help families be able to better support their loved one, as well as take care of themselves and practice good self-care. So we're also reaching out to youth and young adults to open the dialogue about mental health, suicide prevention, and how to help a friend with our NAMI Ending the Silence for Students program. As well, we are there to also support staff with a presentation and community members. So we're able to share our firsthand experiences with the students. We were looking for young presenters to go into the schools, and they talk about their mental health experience. And we really feel that this is a great door opener before you bring in all the other educational components, because it gets the kids talking. And so this person would share their own experiences as well as give a presentation. What we've heard from counselors, we've got this for middle and high school students. They want to know, what do you have for elementary students? And so we have a book, it's called Meet Little Monster. It's a coloring and activity book. So it helps the kids understand some of their feelings and has a lot of activities that even the teachers could go through to help the kids identify feelings and how to cope better. So NAMI Vermont, on another note, NAMI Vermont has served on the statewide 988 advisory committee in Vermont, and we continue to advocate to let families know about this great resource. And we need to really reimagine crisis intervention. This is one of our areas that we really want to advocate on. And we need to respond to a mental health crisis with mental health support. And this allows us to intervene early so that people get the right help at the right time. And it doesn't involve law enforcement or hospital emergency room visits. And this approach has 3 areas of focus. So it's someone to call, someone to respond, and somewhere to go. So we've established 988 as that someone to call, which is a great resource, as well as the mental health designated agencies having their own crisis line too. So that this is also available for family members. And I don't think a lot of people understand that anybody can call this number for support. And we're very pleased that this is a 24/7 model here in Vermont. So what if somebody needs a little bit more than just somebody to talk to, right? You need someone to respond, and we need to meet people where they're at. And that includes mobile crisis teams. And it's really great to see the Department of Mental Health now focusing on establishing more systems and more structure around having mobile crisis teams. It's so important to go there where people are to address the issue, to be able to help de-escalate a situation. And, Other times, if you didn't have that, the only resource people had was going to the emergency room, and that's the wrong place because people aren't getting help when they need it. So if they do respond and, well, they need a little bit more support, then what? They need somewhere to go. And the only somewhere to go is hospitals in the past. So what we really envision are urgent care models, diverting from the hospital emergency rooms and have this both for adults and youth. Now, I know there's pockets throughout Vermont that are starting this. Some might just be for youth, some might just be for adults. We need it for everybody. Everybody matters. And we need 24/7 care because what's going to happen? They're going to go to the emergency room where they're going to languish weeks, months sometimes from some people. And so we really need to establish something instead of the somewhere to go prison, because you interact with law enforcement and it escalates the situation. My own family has been in that situation as well, where the wrong thing to do is to call law enforcement. And sometimes it's the neighbors that are calling law enforcement with a crisis intervention. So you want the right people to respond to help escalate. So this model also requires peer support as an essential component of the workforce that NAMI Vermont supports. And I really feel encouraged that we're moving in the right direction, but we still have such a long way to go. With supported housing is something that I hear from a lot of NAMI members, that their loved one is constantly going in and out of inpatient support and treatment, only because they don't have that step down. There's not that continuum of care. A lot of times people are released from the hospital and go right home, and they're not ready. They're not ready to be able to help support themselves. So how can we create more of those step down options to help people as well? How do you help people in the community? Some people with serious mental illness who need 24/7 support need that supported housing. And there are very few options. So I just want to ask you to continue to increase support for mental health and create a system of care that is healing and promotes resiliency. So thank you so much for listening to my comments today.
Thank you, Lori. I'm always surprised how much NAMI does. So thank you for laying that out. Any questions?
We had testimony that there wasn't a shortage of beds. And when you were just talking, you talked about people languishing in emergency rooms, and I know that was happening. Is there any validity to that statement that we've got plenty of beds?
I don't know what the current status is. I think, hearing from the hospital system about what those numbers look like. But there have been instances I've heard from family members throughout the state, weeks they've been in there because there wasn't a place to go. And sometimes there might be other factors, like there may be some medical and psychiatric components to it, that there wasn't a right placement, so they stay there longer, or there could be co-occurring. And a lot of times they send people home. And that you got to wait for a bed. And by sending people home, you're not getting them the right care when they want it. They're there because they want help. They send people home because there's not enough places to get that treatment, to get that support when you need it. Establishing more respite beds, crisis beds, peer supported models are all great alternatives.
Okay.
Alan and then Daisy, and then we'll.
What's the number of volunteers you have in your organization?
We have about 50 volunteers. We're always looking for more people, of course, to be able to help administer our programs. And all of our programs are free. We train all of our volunteers to do this. And a lot of people find that they want to give back to other people. And they just find it so rewarding to be a part of a support group, knowing that they can make a difference in somebody else's life. We're looking for board members too, if anybody's interested.
Daisy?
Thank you so much for your years of service to Vermont and NAMI. I know I've really benefited from it and really enjoyed the events on Monday that are online. I don't know if they're available
Yes.
to go back and watch, but they were really powerful. I learned a lot. And wanted to say thank you for letting us know some of the ways that especially youth are needed in providing prevention and kind of upstream supports. I know I've learned in here a lot about the needs for more crisis care and how we can help alleviate the bottleneck in terms of inpatients needs and things like that. But it's really powerful to hear you say that youth are needed to go into schools and things like that, because we don't often hear of a need until it's at the point of crisis and the highest level of care. And at that point, it's difficult, I think, to come up with, a policy solution.
Yeah.
But hearing from you that there are simple ways for someone to volunteer and step up into a leadership role, even when they're in high school, and just being their authentic self and talking about their experience is one of the most incredible ways that people can just help each other. And it doesn't cost anyone anything, right? And it's just,
Exactly.
thank you for recognizing that those are some of the most effective ways that people can help each other. And there are solutions that can happen outside of a policy fix that are still valuable to this committee. So thank you.
You're welcome. Just being there to listen to people. Sometimes that's all you really need to do. You don't even have to say anything. And a lot of times I get calls at NAMI Vermont. We have a warm line, and parents or individuals with mental illness call. And sometimes I don't have any resources to share or solutions, but it's just so helpful for them to get it off their chest, to know that other people understand. And there are support groups for that ongoing support to be able to help with your own self-care too.
Thank you, Lori, very much.
Thank you.
Thank you.
Abigail Hutchinson. Hi, how are you?
I'm good. How are you?
We're great. Thanks for joining us. If you can introduce yourself and then provide whatever testimony you want to provide.
Absolutely. Yeah. So I'm Abigail Hutchinson. I go by Abby. I work at Northwestern Counseling Support Services. And I'm here today to tell a little bit of my personal story and also how I've benefited from a therapy called DBT. I did an outpatient program through UVM, the Seneca program, and I learned a lot of DBT skills to help me cope with my anxiety in particular. So I'm here today to talk about dialectical behavior therapy, DBT, which is a type of therapy I have benefited from and one that I would love to see used more with children. DBT was initially created for adults with borderline personality disorder. However, it has been modified for children. DBT is comprised of skills divided into 4 categories: mindfulness, interpersonal effectiveness, emotion regulation, and de-stress tolerance. I will talk about some skills from each category that I believe are tangible and adaptable to any age. With the rise of depression and anxiety amongst children, I believe that finding ways to incorporate DBT and its skills into Vermont school curriculums and designated agencies would be a positive step. As someone who does not work in schools or with children, I would be interested in talking with school counselors, therapists, and committee members that have this experience and discuss what the implementation of DBT might look like, as well as ways that it is already utilized. My interest in using DBT with children comes from my memories of being a painfully shy, anxious, and stressed out child, particularly in the school setting. I believe that learning how to breathe and be in the present moment, Developing assertiveness in social interactions and managing my emotions would have been incredibly helpful. As someone who has participated in DBT groups, I have found mindfulness skills such as breathing, paying attention to my five senses, and gratitude journaling to be helpful in decreasing racing and ruminating thoughts associated with my anxiety. A breathing exercise that I like to practice, and I think kids might as well, is breathing in and saying in my mind, inhale 1, and breathing out and saying in my mind, exhale 1. I do this until I reach 10 and repeat it until I feel less anxious. Another breathing exercise that I enjoy that I think kids would find fun is star breathing, where you inhale and exhale while tracing the outline of a star. Our minds can be a chaotic, busy place, and developing a regular mindfulness practice can help manage symptoms of stress and anxiety and decrease negative thinking. The skills outlined in the interpersonal effectiveness category of DBT involve finding ways to improve communication. I have been working on finding ways to communicate my wants and needs more effectively, and it has made me feel freer and less tense in my personal relationships. There is an acronym in DBT called Dear Man that allows someone to express their wants and needs in an assertive and respectful way. Another acronym called GIVE allows people to build relationships with one another by validating how the other is feeling. I think developing those skills at an early age would allow children to learn how to manage conflict in a healthy way that doesn't involve confrontation or extreme repression of feelings. Emotion regulation is important for decreasing vulnerability to depression and anxiety. One of the emotion regulation skills is the PLEASE skill, which is also an acronym. It involves making sure all basic needs are met, such as tending to physical illnesses, eating a balanced diet, sleeping well, and exercising. When I think about these needs and notice when one or more is not being met, I try to address them. For example, I might realize that my negative mood is attributed to a bad night's sleep or not exercising. It is important for kids to address the PLEASE skills for their mental health and success in school/other areas of their life. De-stress tolerance also goes hand in hand with emotion regulation. The TIP skill is one that I want to incorporate more into my life when I'm feeling overwhelmed and can be used by adults and kids alike. It stands for temperature, intense exercise, paced breathing, and progressive relaxation. Cold water has been shown to slow down heart rate and increase blood flow to the heart and brain. Cold water can be utilized by splashing it on your face or putting an ice pack or bag of frozen veggies on your eyes. Intense exercise involves running, doing jumping jacks, etc., until you are tired. Paced breathing is counting your breath in and out, much like the mindfulness activity I listed above. Progressive muscle relaxation involves tensing and relaxing muscles and usually goes from head to toe. There are many guided progressive muscle relaxations on the app Insight Timer. The TIP skill is an effective tool in slowing down the mind and decreasing the urge to engage in self-harming behaviors. So I'm somebody that's very enthusiastic about DBT and the numerous skills it encompasses. I think implementing it in schools and designated agencies would be helpful in the decrease of depression and anxiety amongst kids. The skills I listed above are not all the DBT skills, but some of the ones that resonate with me the most. And in this written testimony, I've shared some resources that I used in writing this testimony. So thank you very much for listening and letting me testify.
Abby, thank you very much. I plan on printing off your testimony and taking it home to my 15-year-old son, so.
I'm sitting here doing some of the breathing
Right.
exercises, so thank you for putting me in my body today.
It's really wonderful. If you don't mind, I think we have a couple questions, Mari.
Just to add to the comments, you've already helped me because I haven't been doing my morning practices that include some of the things you mentioned. So I'm going to be getting back to it. And I love Insight Timer. I think it's a great tool. Thank you so
Absolutely.
much. You've already helped a bunch of us here.
Yeah. At least some people watching online, so thank you.
Thank you.
Any other questions or comments for Abby? Leslie, is that a hand or you're raising your jacket?
Just
Okay.
jacketing.
Great. Thank you, Abby, so much for sharing and for your time today. Enjoy the
Yeah.
rest of your day.
Thank you.
And next, I think we have Diane Bugby. Hi, Diane. I think we've had you on, have we had you on Zoom? Or is this your first time in here?
2 years ago.
Yeah, that's what I thought. Okay, great. Welcome. And if you can introduce yourself and then go forward with your testimony.
Hi, I'm Diane Bugby, and I'm a family support consultant with the Vermont Family Network. And today I'm here to read into the record testimony prepared by Karen Price of the Vermont Family Network, who is the co-director of family support for the Vermont Family Network. You will have a written copy of this testimony and with Karen's contact information, should you have any questions and want to dig deeper. So first of all, thank you for this opportunity to talk with you today. This testimony will focus on schools and mental health. Vermont Family Network is Vermont's federally designated parent training and information center. Our organization has been supporting families for more than 35 years. They're also referred to as PTIs. They exist in every state and are required by the Individuals with Disabilities Education Act. VFN provides family support consultants who are skilled parents of children with disabilities who support families in accessing services for their children in the school and community. As required by the IDEA, VFN provides parents with information and resources to help them advocate for the provision of a free and appropriate public education, also known as FAPE, in the least restrictive environment to which a child is entitled. To achieve the IDEA expectations of a PTI, VFN operates a statewide telephone helpline, provides in-person support to families, and may attend school meetings with parents in extraordinary circumstances. VFN also attends Act 264 meetings. Act 264 is a statute in Vermont which refers to the entitlement for the coordination of services. VFN provides written materials and conducts training on a broad range of topics of interest to families and professionals who work with children with disabilities. Parents contact us when they have concerns and questions about their child in school. Special education laws and regulations and the mental health system of care can be very confusing for parents who are already overwhelmed with the challenges involved in raising a child with a disability. In 2023, Vermont Family Network had over 6,000 contacts with parents. Of these contacts, 1,200 were with parents of children with mental health diagnoses. Families of children with mental health diagnoses call VFN about the special education process and eligibility, Section 504, Act 264, identifying community resources, and overwhelmingly behavior issues in school. Here are some of the issues we hear about for this group of children and youth. School-based anxiety resulting in chronic absenteeism. Children are often lacking specifically in the form of a well-written, they're lacking services in school, in particular, a well-written functional behavioral assessment, which could provide behavior supports that would prevent behaviors from occurring or even escalating. Increased use of exclusionary discipline, including suspension and expulsions. And we've also heard that schools may actually have all the information they need to keep behaviors from escalating and a behavior plan. However, not everyone at the school is following the plan due to a lack of expertise or staff resources or both. Teachers may have knowledge about how a disability manifests, may lack knowledge on how a disability manifests, blaming a child often for the child or family for the behavior. Children on Section 504 plans often don't get evaluations before a change of educational placements, which is required by regulation. Behaviors that escalate into safety issues, property destruction, and endangerment to self and others. Lack of alternative education placements. A fractured system of community-based and higher level of services for children with co-occurring intellectual disability, developmental disability, also referred to as ID, DD, mental health, and medical challenges. I have some specific examples, but I don't know if child situations that I could share, or you will get a written copy of this. Would you like to hear one or two?
One would be great. Yeah.
Okay. So this is an example, a 12-year-old with a diagnosis of attention deficit hyperactivity disorder, anxiety disorder, and post-traumatic stress disorder. This student was on a Section 504 plan, although the parent had asked for a special education evaluation several times. Section 504 of the Rehabilitation Act guarantees that students with disabilities who qualify must have access to all academic and non-academic activities and programs. The school said that this student was too smart for special education. They were suspended for misbehavior on the bus and in school. The parents had to go before the school board to plead their case. The superintendent threatened that the child would not be allowed back on the bus, even though it would be a hardship for the parents to get them to school. While suspended, the child was admitted to the Brattleboro retreat. The school team held a meeting to determine if the behavior was caused by or directly related to their disability. This is referred to as a manifestation of, and the hearing is called a manifestation determination hearing or meeting. The teachers and behavioral supports team felt that the student's Section 504 plan included appropriate accommodations, stating in effect that the behavior was not a result of them getting enough support. One teacher said the student was not anxious. The team asked the school social worker to describe how anxiety presented in school and on the bus. The picture she painted aptly described the behaviors the team had witnessed. The team reconsidered and supported a comprehensive special education evaluation once the child had returned from the Brattleboro retreat. Unfortunately for this family, the child had to reach a real crisis before action was taken to offer a higher level of support. The school personnel failed to recognize this child's behavior was the direct result of his disability. So that's just one example of the types of calls that we get. But I would rather, I won't read the other ones, but I would like to just offer some possible solutions to the different problems that we have here from families. So annual trainings for new 504 coordinators and classroom teachers, since they don't typically have a disability background. More training around how to conduct a good functional behavior assessment, how to write a good behavior plan, and how to administer the plan once it's written. Restorative justice practices should be implemented and used in schools, and we know that that does happen in some schools. More mental health funding so that schools are not bearing the burden of all the supports. We should be making sure that multi-tiered systems of support are built on strong foundations, particularly as we are trying to address challenging behavior sooner and with better results. Mental health, developmental, medical, and education systems, i.e. the Agency of Human Services and the Agency of Education, work to create systems of care that work more in concert with one another so that families do not bear the burden of piecing together an unnecessarily complex system of care. Thank you for this opportunity.
Thank you very much, Diane. I think we had a question, Art.
Yes, you mentioned the term restorative justice, and I've never really understood what that is. Can you explain it to me in the terms of
So it's not my area of expertise, but it's a different way of resolving a conflict, making amends, righting a wrong that happened. It's a different approach to.
So we're not disciplining, we're doing something different.
Well, it's accepting responsibility and accountability and making amends with the person that you've harmed.
Are there examples in school where this happens?
There are schools that do this. I don't have those examples right here.
Okay, no, that's
But-
fine. I get it.
I do know that Karen, who is the co-director of
Yeah,
Family
yeah.
Support, she would be able to dig deeper with you if you would like more
Well,
information about
it's not
some of
really
these.
Well, and I just will say, if you do want more information, Representative Karen Dolan
Oh.
works in that field and she'd be happy to talk to you. And you might also have a CJC in Rutland, a Community Justice Center,
Yeah.
which if you do, I would reach out to them. It's not appropriate in all
I'm just
circumstances,
reminded
right?
of- right.
There are circumstances where discipline is probably needed, but it is a way to
Yeah,
resolve an issue
Yeah.
between the person harmed and the person who caused the harms.
I will say that we are also sharing this testimony with House Education.
I was gonna ask,
as
okay,
well.
great.
I'm sure
We just
you
think,
are. Yeah.
it's connected.
Yes, and we've been working with them on mental health in schools, so great. Pepper?
Do you know if there are any new methods to help those that are intellectually disabled, that are 22 years old to 60?
We don't necessarily focus on that. Most of the families that we support are up to age 22. I know that the Department of Disabilities, Aging and Independent Living oversees designated agencies around the state that have developmental disability services programs that can speak more about their transition to adult services and what supports might be available to that age group.
Eleni and then Daisy, and then we'll move on.
Top of my head was going in a similar direction. I was curious what kind of supports you give to families and to children as they're transitioning out of high school into career or college. That readiness services is a tricky time and very important.
Yes, and we do hear from families at different times of transition. The Vermont Family Network has a person that her expertise is in transition, all things transition, and we have a transition toolkit that's available on our website that's available for families and the professionals who support them.
Thank you for that work.
Daisy?
Can you talk a little bit about where the funding streams are for the Family Network? You've mentioned mental health, you've mentioned AOE. Is there a DCF component within AHS?
And is it all federal or state?
So so we receive, we're the federally designated Parent Information Center. We and the Family to Family Voices designee. So we receive funding from the health department. We have some funding from the Department of Mental Health that supports our Act 264 work. But in terms of all of our grant funding, we also have a development team that works on donations and funding through that realm as well.
But your oversight within the state, who does the oversight?
I would defer to Karen Price on that. I can tell you that we're an independent nonprofit organization and we rely on grant funding, but beyond that, I don't manage any of the grants, so I wouldn't be able to provide all of that information.
Got it. But I can look at Act 264 and kind of see
Oh,
where
well-
you are in that.
Well, Act 264 is actually, it's a statute within the state of Vermont that entitles a child with a disability to coordination of services. We receive some funding to support families as parent representatives on their Act 264 teams. We receive some funding for that from the Department of Mental Health through a grant. We also have a partnership with 3 designated agencies within the state that provides funding for a family support consultant to support families that are navigating that Act 264 process as well.
Are you on the board of the Act 264 report? I've seen you as an author on that, I feel like.
Oh, well, I've gone to Act 264 board meetings. I retired from Dale a couple of years ago. So I was involved in different capacities as a children's specialist. I don't know, we may have
Okay,
connected
maybe
there.
that's what I'm thinking of.
So,
Okay, thank you.
Thank you so much, Diane.
thank you. Thank you.
Catherine Parker?
Hi,
How are you? Welcome.
sorry, I don't have anything written.
That's fine.
Called upon this morning.
Okay.
So please give me grace.
Absolutely will.
Acknowledge your bravery.
Well, I'm Catherine Parker. You can also call me Kat. I work with Vermont Psychiatric Survivors as a peer supporter. And right now I just go into hospitals and facilities and help provide support for people that are in kind of the height of their mental health journey. Some people, they've been in a few times, but, it's still that kind of peak come to a head moment when someone is in a facility. And so what I do is I go into the facilities and I talk to anyone that wishes to talk with me. And I help patient peers, we call them peers. I try to use the language of the facility. So any given day I could call a peer, a resident, a patient, I try to stick with that language because it is, I find, easier for the person to absorb. Also helps me talking to staff because I try to connect with staff as well. And so I go in and I just talk to people, whoever wishes to talk to me. I talk to them like a friend would. And I help give them ideas for services and helps that they may not have thought of. Like the other day, I was talking to a peer and they were very worried about how they were going to pay their rent because they were currently hospitalized. And they were very worried about how they were going to pay their rent and their bills. And they were also worried about losing their job. And so me being who I am, knowing what I know, because we all have our own lived experiences, all our support people do, I said, oh, had you thought about FMLA, family medical leave? Short-term disability can also maybe be a good option. And she just looked at me, she goes, oh, I hadn't thought of that. And we got talking about that process and how I could help. Now I can also help people with paperwork to the best of my ability. I have been with Vermont Psychiatric Survivors since April. So I am still very new to mental health, but I'm not new to the medical field. I worked as an LNA for 12 years prior to this. And I worked as an LNA in hospitals throughout the pandemic, even working on a COVID ward at one point. So I've definitely seen every facet of medical.
Definitely.
So I come with my own experience of having ADHD and dyslexia, generalized anxiety disorder, depression, major depressive disorder, and complex PTSD. And I tell you these because I am not shy to share my mental health. I take a very, what I call Carrie Fisher approach to my mental health, where I am not shy about it and I'm not shy about talking about it. And I find a lot of my peers, it helps them connect with me. And I find that that level of peer support is very helpful to everyone. And while there are many different flavors of mental health, because everyone may have a diagnosis, but their process to get to that diagnosis was unique to them. I at least come in with that base understanding. And I tell them that too. I say, hey, everyone has their own experiences, but I can come at you with this level. And I can come with that understanding. And we have staff members that come with their own understanding. Everyone that works for Vermont Psychiatric Survivors has been through their own mental health journey. We even have a few of our workers that have been through addiction and have overcome it and are survivors and have stayed clean. And we do help with those people. I have a coworker who runs an AA group. And so that level of support is very helpful to people in Vermont. And right now we are only working with adults. We only work with people 18 and up. A lot of our peer supporters have wished to work with youth and younger people because everyone needs that help, and having someone that has lived that. And hearing that NAMI and all of these other groups are achieving that is so heartwarming on a personal level. I've been a Vermonter my whole life. This is my first time in the State House. So on top of that, it's exciting. Yeah. But it's very refreshing to see Vermonters just wanting to help each other. And I think that is the core of Vermont, is we want to help each other. We want to help your neighbor. My father, he would help several different farms in Grand Isle when he was growing up there. And that's, I feel, the core of Vermont, is we try to help each other at everyone's different levels.
Thank you. You're obviously probably very good at this because you're very calming, relaxing tone, and it's wonderful. And we actually have a peer support bill in front of us now. So your personal experience sharing it is very helpful. We have a couple questions. Top on Mari, Leslie.
Thanks for coming in. Can you just tell us, how do you get in the hospital? You said I used to kind of go into the hospital.
Yeah, so I go in as a visitor. We do have MOUs. Pardon, yes.
Understanding, yes.
Sorry, I'm dyslexia. I have a hard time pronouncing words sometimes.
No worries.
So yes, we provide MOUs that are signed back from the hospital and our facilities. And so we have that understanding, but I sign in as a visitor.
But the hospital has contracted with Vermont Psychiatric Survivors to have peer support in the hospital.
Yeah.
Okay.
So we go in like that. And like I said, I go in as a visitor, but we do have that MOU in place.
Thank you. I was wondering how you got in there.
No, absolutely. I actually, right now I cover 5 facilities, working on the 6th, and hopefully soon maybe a 7th. So.
We like to hear that.
That's terrific.
Mari?
On a related note, I'm a nurse that works in a hospital. We often don't have time to spend with patients the way we would like to, and would be really helpful to patients. And in fact, I would like to call you sometimes to come talk with me. Well, days that you're there. So with the MOUs, like could one option I see, I could just recommend to a patient that they call Vermont Psychiatric Survivors?
Yeah.
Or do case managers
So
contact on the patient's behalf?
when I go in, I give my personal card with my number. I facilitate a warm line and encourage people to call. And like I said, I just kind of provide that support network. Sometimes it's just helpful for people to be heard. Like you're saying, you wish you could spend more time with your patients. And as an LNA, one thing that I always put in my practice from day one is to let the patient know that I'm human too. Sometimes I feel like with clinicians, patients will sometimes put them on this like pedestal or this higher level. And one practice that I always did as an LNA was, no, I'm a human being too. I'm here to support and help you. And so to be able to leave that world and come to a world where that is my job, to just talk with someone and say, no, I'm a human being too. these are my experiences. This is what I've lived has been incredibly helpful, I feel. And I get peers all the time after we're done talking, when I have to say goodbye, they'll say, thank you so much. You've made me just feel human again in this sterile environment.
Leslie?
Thank you. Yeah, thank you. Lori mentioned the bill about peer support and certification. Is that something that you've talked about in your world, and would you consider getting certification? What's your sort of thoughts about that?
As I stated, I'm still pretty new to this world. I've been with this organization since April. I don't have much to say about the certification. I'm still learning about it myself.
I understand. Yeah.
But I feel like maybe a certification would help hospitals trust us. I feel like sometimes facilities and hospitals think that we're coming in just to nitpick them, when in reality, we're just there to help the peers. And I think maybe that certification might help in that process of gaining access, because we do talk with like HR. We really try to work with the hospital, meet them at their level to try and come in and visit with people. And I don't know, maybe the certification will help, but I can't say too much on it. I do apologize for that.
That's a great answer.
Great. Thank you for the work you're doing on behalf of Vermonters, and we appreciate you coming in at the last minute.
And thank you for giving me grace.
All right, let's be back